These companies, these insurance companies, are deliberately doing this because it's free profit and there's nobody there to stop them. They are mercenary raping the country because they can.
And we just
Point
had
blank.
a high-level CEO of what was it? What healthcare company was that?
I forget which one it was. Hang on, I can pull that
Yeah,
up
he
real
got,
quick.
basically shot down like a dog in the street.
Yeah. He had his
Now,
insurance revoked.
well, here's the thing.
Brian Thompson, United Healthcare CEO in
Yeah.
New York City. Yeah, he got his healthcare revoked.
He got whacked and capped.
Mm-hmm.
Now, I don't want to see anybody die. I really don't. But
It's too late.
I'm going to explain a situation to you. Let's just say person X, retired military guy, did some of the higher level stuff,
Uh-huh.
has to go to the doctor, diagnosed with low-grade leukemia. He
Right.
starts doing the chemo, doing all the treatments. He's having
Mhm.
it's going in his direction. Maybe it'll go into remission.
Yeah.
Then all of a sudden the insurance company goes, we're not paying for it anymore. Take us to court.
Yes.
Well, that's going to
My
take 2
brother-in-law
years.
just had something similar happen.
That's going to take 2 years.
Yeah.
Now, if this guy is going to more than likely pass away from said leukemia, he might feel a particular way about it and decide, you know what?
I
Maybe
don't have anything to lose. Yeah.
Yeah, he has nothing left to lose, and he's going to leverage his skills
Mhm.
to maybe get some pre-retribution.
Yep.
Yeah, and you know
Yeah,
what?
and he's dying anyway. What are you going to do to him? Seriously.
Yeah, even if he gives his hands up and says, I surrender when they come to get him, what are you going to do to that guy?
Yeah.
He'll maybe get some chemo treatments in prison.
Yeah, he's already been sentenced to death. You can't do
Yes.
anything to him.
I mean,
And we're not, to be clear, we're not recommending any courses of action. We're just saying certain things become inevitable after a point.
correct.
It's the way shit, like this CEO getting whacked in the street. Come on. I mean, the guy walked up behind him and it was somebody, in my opinion, it was somebody wanted that guy gone, and it wasn't the guy pulling the trigger. That's my opinion of that particular scenario.
Yeah, I don't know the details, but when I saw that happen, I was like, we're going to see more of that.
Mm-hmm.
It's going to happen.
Yeah. Yeah. That's crazy shit. That's crazy shit. Where were we? Oh, yes, that's right. Americans' challenges with healthcare costs. This brief was updated on July 11th, 2025. So we've got good data here. For many years, KFF, what is KFF, by the way? The independent source for health policy research, polling, and news. We'll have to keep an eye on them. That sounds useful. Just under half of U.S. adults say it is difficult to afford healthcare costs, and 1 in 4 say they have a family member in their household who has problems paying for healthcare in the last 12 months. When I worked at the law firm that I mentioned, I saw this all of the time. There are safety nets here and there, but what that means is the taxpayer eats the cost. And usually it's only a certain demographic who has access to that sort of thing.
Correct.
An urban demographic from the lower west side of Detroit.
Yeah. If you are
primarily
white, you're not getting shit.
You're not getting anything. Yeah, I've also seen that. Black and Hispanic adults, those with lower incomes and the uninsured, are particularly likely to report problems affording health care in the past year. The cost of health care can lead to some to put off health care. I think a lot of people are doing that. About 1/3 of adults say that in the past 12 months, they have skipped or postponed getting health care they needed because of the cost. I would bet you that number is probably higher. Notably, 75% of uninsured adults under age 65 say they went without needed care because of the cost. Then there is the segment of the population, not unlike myself, who just doesn't. If I'm not sick, if I don't have a bone broken, I'm not going to the doctor. That's something I learned from the older generation. They just didn't go to the doctor. My grandma and grandpa, people like that, they didn't. Nobody went to the fucking doctor until they got sick.
Devil's advocate. A lot of men out there don't go to the doctor when they should go to the doctor, and it's not because of costs. They just can't be bothered, and until one of their nuts falls off and they wind up, circling the drain. They're like, well, maybe I should have seen that doctor.
Keep your surgical gloved finger out of my rectum.
Yeah. That is going to happen.
A lot of guys. We don't want we don't want any of your sphincter inspections. Just no.
I got some stories about that one.
Yeah.
Oh,
Had enough with that, with the freaking airborne every 6 months. Why? Why did they do that every 6 months?
I don't know. It's crazy.
God. Okay, where were we?
Sorry, man.
I'm traumatized. I'm having latex nightmares. That sounded wrong. No homo. Those who are covered by health insurance are not immune to the burden of healthcare costs. That is extremely true. Almost 4 in 10 insured adults under the age of 65 worry about affording their monthly insurance premiums, and large shares of adults with employer-sponsored insurances marketplace coverage rates their insurance as fair or poor. One of the big things is the damn deductibles.
Yeah.
You get insurance, right? Okay, I've got insurance. I'm paying $900 a month for insurance. I'm covered. Okay, that's $11,000 a year I'm shelling out for insurance. Nothing happens to me for 5 years. That's $33,000 I should have built up, right? No.
Correct.
You get to the doctor, you get like something breaks, and you get a medical bill for $1,200 or $12,000. You think, okay, I've got $33,000 worth of insurance bill backed up. No, you still have like an $8,000 deductible. And a lot of these insurance companies are doing exactly that. They practically bill you a whole year's worth on the deductible, which just crushes people, because what am I paying all this insurance for? If I get hurt.
Yeah. You're just giving them free money.
Yeah, it's fraud. It's absolutely fraud, the way they take these payments and sit down and here, math it, Pop. Let's say I'm paying $923 a month, and I pay that for 3 years. That's 36.
Yeah. 900 what?
$923 a month over 36 months.
All right, so it's 9,000 plus another 1,800. That's 10,800 bucks rounded times 3, 30,000. It's like $32,000.
Right, and that's what I paid into insurance, and then I break my knee and I need reconstruction, and that comes to like $16,000, and then your insurance company comes at you and says, "Oh, you got to pay this $8,000 deductible first." Well, where the fuck is my $33,000?
Yeah, that's right.
What have you done with my money that I paid into insurance? Now, one of the things that I know is out there, I didn't look into this. I probably should. I know people have healthcare savings accounts for exactly this scenario. And they'll dump money into these healthcare savings accounts over time and just, fuck it, I'm not getting insurance. Or they'll get the bare minimum of insurance and never use it.
Well,
and if something goes wrong. But if you've got a healthcare savings account like that, if something goes really wrong, like a cancer or something like that, where you're talking $150,000.
Yep. Well, when I was working at Edward Jones, when I took the position, day one, I show up. They immediately, I had a health savings account, and I think they just put 10 G's in there to start.
Oh,
and then I threw more money as it went along, and then you got, it was Blue Cross Blue Shield back then was what they were using.
Okay.
So, I mean, that was cool.
Wow.
But
that's a good one.
Savings account goes a long way to helping shit pay for that deductible.
Well, for the little stuff, for the deductible, that'd be great. But for little stuff, that helps too. You don't even have to touch insurance. You don't even have to fucking look at it, which is kind of a
finger.
Yeah. Well, that goes right to this: the difficulty affording costs. Many adults have trouble affording healthcare costs, while lower income and uninsured adults are the most likely to report this. Those with health insurance and those with higher incomes are not immune to the cost of medical care. Just under half of U.S. adults say that it is very or somewhat difficult for them to afford their own healthcare costs. Uninsured adults, all under the age of 65, are much more likely to say affording healthcare costs is difficult compared to those with healthcare coverage. Additionally, a slight majority of Hispanic adults and half of Black adults report difficulty affording healthcare costs compared to about 4 in 10 white adults. I think they made that about race for no reason, because I did not see that.
What we have?
I saw the opposite when I was in personal injury. Our Black clients, point blank, almost always ended up getting their healthcare coverage. But that was not always the case with our white clients.
Yep.
So I saw firsthand the opposite effect there.
I'm just wondering when that is going to generate the lawsuits, because that's reverse discrimination.
Yeah, pretty much.
Opinion.
Yep.
I don't know, man. I don't know. I remember taking my dog Ranger to the vet when he got attacked by a dog.
Oh yeah. Oh my God. Yeah. Don't get me started on vet bills.
Yeah, he got a bunch of stitches and shit like that,
Mhm.
and I got the bill, and I was like, it was like $700.
Yeah.
Like, it's not that bad.
Just
with
taking
my
our
medical
dog
insurance.
Midnight to get a checkup was $300.
Yeah.
And they wanted $3,000 to do dental work on our 15-year-old dachshund. I'm like, she's 15 years old to begin with, and she's a dachshund. If you do major surgery on her, it's probably going to kill her. So guess what? I'm just going to take her home, make her comfortable, and do the best I can to clean her teeth until this goes away. And that ended up working. Because they wanted $3,000 to do dental work on a 15-year-old dachshund. I'm like, you're probably going to kill my dog for $3,000.
Yeah,
fuck you.
That's not worth it.
I will take the dog home and care for the dog myself. And that way, if the dog dies, it's my fault. I can accept that, and move along from there.
Watch Grunt Speak live every Tuesday and Thursday at 8 p.m. Eastern. And if you want to join Pop for Supporter Sundays, go to redonkulous.com/donate and make a monthly pledge. A link is in the Meat Gazer box.